There has been a number of disasters in the past 4 months or so. While some, such as floods, are not unusual, their existence alongside the COVID-19 pandemic has presented the world, governments and citizens with unprecedented challenges. In Kenya, the government and citizens seem to be trying to survive this, but not without pointing fingers at each other.
We will escalate or de-escalate measures in accordance with the behavior that we observe. This is no exception. I just said earlier that this intervention was supposed to secure some form of livelihood for some people, even as we observe the measures that, that we have taken. And it is true that it has been abused. It is a fact of life that people have been going to pubs or to eateries. They order one sausage with 2 beers. They eat that one sausage. Anakula hiyo sausage moja na bia mbili. Anatoka hapo, anaingia hoteli ingine. Huko anakula bia mbili ingine na sausage ingine moja. Anaingia ingine, anauliza chungwa. Ati sasa ni dessert.
Government is doing what we must do, and please, for those who like all the time saying that it's not fair to push people out, we do not have an option. We are moving some people out by force.
Notice ya kuna ndio hii corona, ndio hii ati kuna corona. Alisema watu wakae kwa manyumba. Manyumba ni kukaa nje.
Are there more positives, in terms of reports that meets the eye? Can there be a middle ground between government and citizens in terms of our way forward? Hello, I'm Joaquin Boshe, and welcome to Utafiti Hub. For a broader discussion on this particular matter, we are joined by 4 distinguished panelists. We have Koitamet Olekina. If you could just wave Bwana Olekina. Bwana Olekina is the former Deputy Coordinator, National Crisis Response Center. We also have Nerima Were. Nerima, if you could just wave. Thank you. Nerima is an advocate of the High Court of Kenya by profession. She also teaches at the University of Nairobi School of Law. We are also joined by Bwana Kamau Mbugwa. He's an advocate of the High Court of Kenya by profession and a commentator on public interest matters. We also have Roland Ebole. Roland is an advocate of the High Court of Kenya and an expert in human rights. Thank you, ladies and gentlemen, for making time. We'd also like to thank all those people who are supporting us in one way or the other, including Dr. Kevin Gidhui Murithi. Thank you very much. Bwana Olekina, if we may start with you. This issue of, the natural disasters such as COVID and the fact that it's here and we have other things such as the floods and the locusts attacking us from all corners. What is your take in terms of how prepared as a country we are and how we have been able to respond to these issues?
Thank you very much for having me. I think we are not ready as a country. We have been firefighting. When you see we have a national disaster management policy, which stipulates what should happen and who should do in terms of institution, in terms of all the stakeholders who are, they're supposed to respond to a disaster. But when a disaster happens, that is not followed. You can see how we were responding to the locust, disaster. How many institutions were involved? You could see that the ministry was coordinating. Okay, sometimes they would say, take a picture to see whether it is actually a locust or something else. So the point is, we have a lot of literature we have written, we've sat in lecture rooms and boardrooms and made a lot of plans, which we do not implement. We do not even allocate adequate resources for disaster management in the country. So when we talk about preparedness, how can you talk about preparedness when you have not allocated resources to respond? When you go to Parliament, when we are allocating resources, what kind of resources do we allocate for disaster management? We say we have a contingency plan and a contingency fund. So that fund is used to respond to everything else. whatever problems we have, we use that fund to respond to as a country. But if we had set apart or aside resources to respond to pandemics like this, because you see, when the locusts came, they came from Ethiopia. We should have been responding, or at least making sure that, because we saw them coming and we knew that they would be coming, there was enough warning. What did we do? Because it is not just responding. How did we try to even prevent the locusts from coming? What preventive measures did we have? And if we could not prevent, as soon as they landed, how did we respond as a country? We deny. We are left with denial a lot of times that it's not going to happen. Even when we have COVID, we were saying it will come. Let us close our airports. Let us close our borders. Others were saying, no, it is not there. We shall handle it when it comes. It's here. How are we handling it now? So I think we are casual as a country in the way we deal with disasters. And sometimes we look at numbers. We say if they have not killed very many people, so it's okay. But is that the way we should be handling disasters? Must we lose lives so that we can actually accept now that it's a big problem we have to deal with? We are not prepared.
So, and you know, leading into that particular point where Bwana Olekina says we've been firefighting, we've been dealing with these issues casually, we need to take responsibility. Roland?
What I'm thinking is that despite COVID-19 being a disaster on itself, a pandemic on itself, the world, and I just don't say this is Kenya, has taken so much of its energy in addressing or trying to look at, you know, the pandemic itself, and many a time at the expense of the emerging issues. For instance, I was just taking account of more than 50 government meetings, or to address the public over coronavirus, yet you have emerging flooding that has killed already more than 100 people, and we've only had less than 3 address from the government on it, at least which has been shown to the public. So you're looking at us really taking a lot of energy, which is very good on coronavirus, and forgetting that we have other issues. Of course, beyond the floods, we are talking about locusts, and we are thinking about food insecurity after we address coronavirus, looking at our production levels have already been rendered less in terms of what we can do within our agricultural sector, with all these, some form of social distancing, stay at home. You find that there are a lot of people that are not going to produce as much as they could in as far as food production is concerned. Then you bring in the locusts and the kind of effect that it will have. Then the flooding, because already we hear more than 8,000 acres of acreage of land has been, not of land, of crops has been swept by the flood. Beyond that, not just Kenya, this is a regional issue. We have floods in Somalia, floods in Uganda, floods in Rwanda. So even if we wanted to depend on our neighbors, then it really becoming a lot of, it will become a little bit hard. So in as much as we deal with Corona, let us realize that the world has not stopped, and also address all the other issues that are also emerging.
Noting that Schedule 4 of the Constitution, with respect to division of county government and national government responsibilities, and we note that item 24 with respect to national government responsibilities says that the national government has a role to play with respect to that, and also item 12 with respect to county government says that the county governments also have a role to play. In your view, have the county, even as we're saying that we're taking it casually, we have seen county governments such as Mombasa, collecting food, for instance. Is that preparedness? And do you think that the counties have played their part? Or Bwana Kamau, maybe we can hear from you with respect to that particular issue.
My perspective on government is a little bit different from Bwana Kina's. I don't look at government as one as one-stop shop. I see government as various levels, including personalities. The idiosyncrasies of the leaders also matter in terms of disaster management. I'm not a disaster management expert, but I've been around for quite some time. And if you look at the years in the 90s and years before that, disaster management was actually done by foreigners here. But since the early 2000s, we are now allocating budget for disaster management. If it was in the 90s and before, a famine was managed by the World Food Program. So first, I would want to begin with a positive and say that at least we have a budgetary allocation. Whether it is adequate or not is another issue. But at least we are talking about managing the disaster ourselves with our own budgets. Then we can come to the level of the institutions. You see, disaster management is not, it's not, you know, the cabinet may sit and give policy guidelines, but the actors are different. You will have actors at the county level, you will have actors at the ministry level, you'll have actors at a multiplicity of levels. And we do know that even in other countries like in America, when when they're dealing with the hurricanes, if you look at the 911, New Orleans, and all those other disasters, you find that in a lot of cases, we are looking at the leadership of the person. Even right now in America with the COVID-19, we have had examples of governors who are doing very well and who are galvanizing the nation to come together, because it's not, disaster management is not totally the responsibility of government alone. Everybody must be active in it. And when there is a failure in certain aspects, we should not rush to just criticize the government. We should ask ourselves, what is going wrong? And when Bonakina talks about the casualness of ourselves, it's not the government, it's the people of Kenya. Our society does not have a common ethos. We are splintered along different identities. And until we resolve that, we will never be able to get to a place where we say we support our government in this endeavor because we love it, because it is our government. So we have, at that level, a failure of having not created a society that is united in terms of how it looks at issues. But that is a long-term project. Coming to what we are able to do, my conclusion would be that so far so good. And if we stop looking at this as the responsibility of government alone, and we play a part, because the private sector and individuals have a responsibility as well, then we might as well begin to help the government to manage this, rather than just sit back and just point fingers at the government.
Thank you, Banakamau. Roland, what's your take on that? Going back to that particular issue that that I mentioned, the one of county government role, national government role, and what Kamau and Olekina have said. What's your take on that issue with respect to our response?
As I was saying, I'm sure there is a lot that we have done, and of course, every society, including even the developed world, we've got different, you've got the society not really acting homogeneously on this. We have some that wants, the cities to reopen, want to go back to business. There's someone saying, the government is not doing enough and all that. So we've seen counties that have really done very, very well. I've talked about Mombasa. The other week I was noticing Machakos was setting up, beds facilities and facilities for treating, emerging cases of corona. So there is a lot, of course, that effort being coordinated with whatever the national government is actually doing. We saw the other week governors meeting at State House, with the president really discussing and churning out some of these strategies. That said, Wakili Kamau, we have also seen the society and business sector really acting well in terms of providing solutions. Yesterday we saw Barclays Bank CEO, not Barclays, Absa now, it's still confusing, CEO, Mr. Wori, among others, donating some, as in relief to help, during this time. And there is already a committee that is made up of so many people, driven by, the business community. So we cannot call them to begin. I'm sure they're already doing this. The society as well is doing a lot in terms of just keeping to the directives of given by the government, which is the greatest part of what they should actually be playing as right holders. There are duty bearers and there are right holders. So respecting the law is also very important. Of course, we have pockets of cases of people running around at night with the ambulances, not keeping to the rules of the curfew and all that. Expected. We have issues around one sausage and two beers and roaming around against what the minister has said. Expect all that to actually happen. So as much as we say that the government is doing to some extent a lot of good things, to a lot of extent also they are only reacting to issues that are emerging, which is a bit not very safe in such an emergency situation, whereby when you become reactive in situations where you've been, you've been warned, you've had prior information on what is happening to other states, and I'm talking also about locust invasion, which it did not just, we did not wake up and we found locusts in Kenya. We did not wake up and find heavy rains sweeping everything in Kenya. All these things have some prior information. We have people that are working constantly to check and see that and predicting some of these things. So to that extent, I think I would say that there is a lot more to be done. We should not be a reactive society. We should sometimes be proactive in terms of just preparing for disasters. And this goes to both our county government, because there's a lot of functions that they do have, and our national government. It's good that they're coordinating efforts on the COVID-19, but we now need to see them going back more and coordinate efforts on the other emerging or the other calamities that are either existing together with COVID-19, were there before like the locusts, or are coming after like the floods. Then we'll be able to say that, yeah, kudos government, you are really doing your best.
My take broadly is I would agree with Bwana Olekine, because I feel like we are addressing a number of issues that we have constitutional provisions that guide us on. We're trying to address in a very short period of time because of a number of pandemics and disasters. So we're trying to address housing, we're trying to address health, we're trying to address social security and protection within maybe 2-3 months, when we've had a constitution telling us we needed to put these things in place. And while the constitution knows that these rights are progressively realizable, what have the efforts that the government has been making since 2010 till today to put things in place? And a good example is disaster management. And when I'm looking at spoken to this, we have the policies, we have the laws, we don't implement them, we don't do the work. And then when we are now forced to do the work, we are surprised. It's very difficult to try to put in place social protection for an entire country in a 2-month period, because now they need the money. Now they need the money to survive. It's very difficult to put that in place in a 2-month period, for you to be able to identify families that might go into poverty in a 2-month period because of a pandemic. Things that could have been avoided had you been putting into place policies, frameworks, and institutions prior to the disaster. And this is a continuous problem with how we manage disasters and pandemics within the context of health. The national and county governments have been fighting for the past decade about who has the role of healthcare. It's clearly the county government in terms of Schedule 4. But now, Afia House has maintained the same budget before 2010, after 2010. 6% of our national budget still goes to Afia House, yet they don't have the function of health. So which means what's going to the counties isn't quite as high as what's been given to Ministry of Health. Now, when you discuss questions with the Ministry of Health as to what are you doing within this pandemic response, they will now tell you, well, our job is standards. Our job is this. We can't do this, we can't do that. But then why do you have the same budget if you can't do this and you can't do that? So the function of the function is supposed to be the county government. They have been fighting about this for the last decade. Now that we need them to understand what their role is, they don't know.
I think what I said is that we do not prepare, we do not set aside funding. But every year, if you look at our budgets, there is money that goes to the counties. What have they been doing with that money since 2010? What, even if we are talking about Mombasa, they just built beds the other day. I mean, they just construct the hospital and with beds and so forth the other day. What other disaster management practices have they had, throughout? We have had these ferries all the time, where, causing disasters in Mombasa. Of course, there is what the county government can do, and I'm not trying to point a finger or at the governor or Mombasa or any county saying that right now they have not done their best. But I think we can do better, as Nerima is saying. If we had been doing this incrementally, by this time we would be more prepared than we are today. If every year we have been pushing an inch.
And if we can just loop what Olekina has said with respect to counties and how they've responded to these particular issues, and even moving away from natural disasters and going even to our own man-made ones. Nerima, coming back to you, we have the recent case that we've had about of what has been going on in Kariobangi. So, even in terms of the county government intervention, what's your take on what's happening in Kariobangi, and whether our response with respect to that, vis-a-vis what is happening, in the grander scheme of COVID, whether that then matches out?
Danny?
Okay, thank you. I just want to give a bit of background to the issue around Kariobangi. So in the last week, about 7,000 people have been evicted from their homes in Kariobangi. And the news reports around that really speak to the fact that the people living in Kariobangi are alleging that they were living there for a period of over 12 years and that they have been evicted unlawfully. So they allege. They said they were only provided with 24 hours notice, and then the buildings were demolished. On the other hand, the other party alleges that they do have a court order for this eviction, and they're only enforcing the court order because the land is their property. So that's like the background to the issue. So around how, I think the timing of this is obviously quite terrible because we are in the middle of a pandemic and a few other disasters. But this is just like they're executing a court order, that's their feeling. However, what really just needs to be understood is we have a massive issue around housing in this country, which then goes back to the issue of, had you been doing these things for the past decade, we would not have these issues quite as horribly in this moment. So we have an issue around housing and access to housing, and we also have an issue around unlawful evictions or forced evictions, which is contrary to our standards, guidelines, policy frameworks, both internationally and nationally. And we already have jurisprudence around this. We have the Satru Sayuma case that was decided by Justice Lenola at the High Court. Basically, quite similar facts. There's a community that was evicted. They alleged that they were there for more than 12 years, which would bring into place adverse possession rules. But all in all, whether or not they had the legal right to be there, the manner in which they were evicted was problematic. And this is quite similar in this case. The manner of the eviction was problematic because we're in the middle of a pandemic. You are removing 7,000 families from their homes in the middle of a pandemic, assuming that they will have access to alternative housing. They say they were given 24 hours notice. That is inhumane, and it is without dignity to give people 24 hours notice to find alternative housing.
And Nerima, just perhaps at this particular point, even now when you're looking at the aspect of national government and county government function, yes. supposing the company that was evicting them was entitled to do so.
Usually starts with the national government, because having a policy framework on how to lawfully evict persons sits with the national government, and that was already specified within the Satru Sayuma case. Can you please ensure that the policy framework is in line with international standards? That's number one. So how to have lawful evictions. And you can also use like comparative examples like South Africa, who have a Prevention of Illegal Evictions Act. The second thing is on the right to adequate housing. That also sits to the national government to work in collaboration with county governments, but in terms of realizing that right, that sits to the national government. So the function of ensuring that adequate housing is provided across the board sits to the national government, working in collaboration with county government. So the issue of what adequate housing looks like is something that has been waffled around for the past decade. We're not quite sure what the plan is to ensure that this is realized. We're not quite sure what low-income housing looks like and where they're going to put this in place, particularly within urban areas. So it sits with the national government. to have the policy framework to avoid unlawful evictions, and then to provide adequate housing for family.
What's your take, Roland, with respect to that particular issue?
Yeah, I think Nerima has really gone into the human rights language so much. Then we should actually also separate issues in as far as, you know, unlawful eviction and forced eviction, and what really, you know, the two mean. But yes, the right to adequate housing has been entrenched as a justifiable right under the Constitution of Kenya, and I think it's Article 43. And it provides that every person has a right to, you know, to accessible and adequate and reasonable standards of sanitation, plus that. And we are also obliged under various human rights, you know, treaties, including the, you know, International Covenant on Economic, Social and Cultural Rights, you know, the ICCPR, International Covenant on Civil and Political Rights, and even the African Charter on People's Right. And we also have, you know, guidelines as in around forced eviction, because governments are supposed to refrain from or prevent forced eviction. And you know, what is forced eviction? We also go back now. That's where now we go into, you know, issues of, you know, was eviction unlawful, you know, as in and all that, because forced eviction means something else on its own. But in this case, one were the residents of Kariobangi provided with an alternative place to go, you know, settle. You know, were they informed about, you know, this, you know, in good time? Was there some form of consultation? How meaningful was it? And all that. And so going to your question is that when evictions happen, when forced evictions happen the way they actually did happen.
Sorry,
yes?
and to that point, just before you leave that point, whose role really is it? Is it the national government or is it the county government to ensure those things, those particular aspects that you're discussing?
It really depends. You know, in a situation of a land that is, you know, under the mandate or the control of a county government, and it's, you know, it's the county government and its various authorities doing, you know, evictions or certain actions, then they'll be acting there as the authorities, you know. And then you have the national government, whereby you have, you know, systems of, you know, you have all as manner of, you know, the backstops at the end of the day with the national government, where you've got all the land as an administration and functions there. So I think it's a multi functions, whereby if the evictions happen because of or the authorities involved were county government, you know, authorities, because this was supposedly their land, or supposedly they are doing that to actually, you know, get you know, residents out to claim back their land, then they're the ones that are there. But in terms of now protection of the citizens or the residents that have been evicted, I think it's both a county and you know, and you know, as in a national government as in function. So it is both. It really depends on how you look at it. Pre-eviction, during eviction, and after eviction. Yeah.
And Bwana Kamau, do you have any comments on that particular issue before I get back to Bwana Olekina?
I'll just speak very briefly, but generally on the issue that Madam Nerima and Roland have talked about. But I wanted to address the issue from a different perspective, and this is largely informed by my view of government and how we should always look at government. We have had even governors complaining that behind someone trying to evict another person, and there is a court order, yes, and someone is being evicted. And we do know that in Kenya we have many cases where disruptions happen with the validity of the law, so that somebody is able to go to court and do whatever it is they want to do very quickly to change the situation on the ground. And this is why I am saying that if we want to get Kenya to a place where we can say that we have policies that work, we can sit here and look at what policy do we have in terms of disaster management. We can sit here and look at what budgetary allocation are we giving to disaster management. But even when you look at the budget, whatever budget, we have official information from government that somewhere around 30% of all our budget is lost to corruption and such other evil processes. So you may have a budget, but you don't have officers who are abiding by the laws that govern, public officers' behavior. Because the reason why we have law to govern how public officers should behave is because we know they do not always behave well. So my point is, we need to really think about this issue from a more global perspective. Ask ourselves, why is it that not just disaster management, a lot of our works do not work? Our activities fall short of what is expected.
And even as we are looking at all those issues, Bwana Kamau, I'd like us to touch briefly on the issue of, the people saying that they're getting conflicting messages from government. So that on one hand, the government is asking, that people stay away, maintain social distance, and then the government goes ahead and allows for certain businesses, more so the hotel industry that, that deals with human beings every time, every day, to operate. And the position of the government says is that so long as you are tested by the time you're reopening. And what guarantees, as Kenyans are asking, what guarantees are there that if you are tested today and you tested negative, that tomorrow you will still be negative? Because it doesn't say that the test should be conducted daily. So Kenyans are saying that they're getting a conflicting kind of message. What do you have to say about that from a policy perspective?
What I would say is that I see when we started having initial suspicion about people coming to Kenya with who might have been infected with a COVID-19. Remember, we were taking our tests to South Africa because we did not have the capacity even to know whether this was coronavirus or whether it was the normal influenza virus or whatever it was. We did not have that capacity. Over time, we created that capacity and we imported the test kits, and we have had even Kenyan entrepreneurs and universities coming up with their own equipment to do that. I would want to look at the issue of the government trying to reopen the economy in certain sectors as a progression of our capacity building that we have achieved probably over time. And remember that when I look at the restrictions that are in place as of today, we are not in a total lockdown. We are not in a lockdown. What has happened is that we have had several areas. Myself, I live in Thika. I'm speaking right now from Thika, but the part of Thika that is in Murang'a, and therefore I am restricted by law not to come to Nairobi. And for the last 2 months or so, partly by choice and partly because of that closure of the metropolitan area, I am working online. So I think it's a question of the government balancing to ensure that we do not kill the economy, because again the economy must go on. You have seen even globally we have countries that are suggesting that we should wait for the herd immunity to take place, so that if you had you can picture, if in Kenya we had an ICU, if you look at the mortality rate of COVID-19, if we had an ICU in every sub-county, looking at the mortality rates and looking at the cases that have so far been confirmed, you might as well say that there is no basis of opening up, of locking any place, as long as those people who might be affected by the infection to a level that they need medical attention to that level, then they should be able to access an ICU.
One thing is that we did not recognize that food is essential when you were actually listing essential services, so that you allowed town to operate until night, but all restaurants are actually closed and you have people working all day. So I totally believe that the government is not sending conflicting information. It is just recognizing that, we should not have closed food places in the first place. And now that we want to reopen, let's reopen it with a plan. And you go to Europe, every country, it is not that coronavirus has gone away. Every country is coming up with a plan on how to, reopen, but in a progressive way. And first of all, to reopen in this, what are the safe spaces or places that we can actually start with? And some of these, I believe that yes, restaurants have got a lot of human interactions, but remember, they are given directives. One, how far tables will be from each other, the staff to be tested. I think that will be continuous. It will not be a one-off, then there'll be, between the food counter and where people make their orders, what is the distance. So there are directives. It is not just a blanket reopen and just do what you really want. And I'm trying to think that as we've been told by Advocate Kamau is that one thing is we're also monitoring how we are doing in terms of managing with the infections. The infections are not going away, but how are we managing? How is the curve? And does the state really feel that it is time to start allowing certain forms of of what was really restricted to actually come back and while still watching? So I really believe it's high time that we get back to business, but on a progressive level, very well monitored, because again, Kenyans can be very indisciplined if left onto their own, as machineries. You don't give Kenyans, bread and just tell them go for it. You can't slices for them and tell them you can only take these slices in the morning, then in the afternoon you can take these. Otherwise they'll take the whole bread in the morning and they'll not have anything else for the evening, or they'll have disaster. So I believe it's a good step, and no conflicting message from the government on that.
So the government can continue to decide which one, on a rolling over basis, which kind of business to open and which one to, and that Kenyans should not find it, conflicting. But still, we have seen traffic growing in the past few days, and I wouldn't say that all those people work in hotels. Anyway, so again, going back to the issue of Kenyans and our discipline with respect to, or even necessity taking us out of our homes. So, and which takes us now back to, on that particular aspect of necessity, Bwana Kamau, we have had donations by various foundations. What is this about people having to pay for themselves when they go into quarantine? And is that really, the right thing to do, especially when you're incentivizing, when you're trying to incentivize for people to actually go get tested?
I try to, whenever I can, tell people never to see government as one-stop shop place. They must see it in terms of who is your leader. Kenyans must start questioning their MP. They must start questioning the minister in his official capacity. They must start questioning the governor. They must start questioning, not just generally, saying the government is not doing this and is not doing that. If you look at America, the CIA, the CIA is a completely separate, it's like a separate government by itself. Then you have the Senate is like a separate government by itself. And then of course, the executive. This is how governments work. There is no government in the strict sense of the word of what government is. That is a one-stop shop. You have decision making at several levels, and people need to start attacking government and challenging government at the closest level. That was the initial intention of devolution.
And so then at this point, Bwana Kamau, can we therefore say that maybe the people who should be taking responsibility for running of the quarantine centers so as not to ask Kenyans to pay are the county governments in compliance with their responsibility for managing of national disasters under Schedule 4 in conjunction with the national government?
Absolutely. It's only that our leaders like populism most of the time, but we know when politicians know they might get popular on an issue, they promise that nobody will be charged anything. But this thing is not scoring points for politics, and that's why probably we have not seen leaders who are doing that. But I think everybody should be admitted without asking anyone to pay anything, because if you start asking people to pay anything to get into quarantine, you defeat the very purpose of the measures that you have put in place to manage the crisis.
Yeah, and Roland, over to you. What's your take on this issue of people having to pay for quarantine facilities?
I mean, it's crazy on its own. We received a case, and this has also been has been the public domain, of this security guard at Lenana High School. So this is a security guard at a place where, you know, people were being brought in for the quarantine, and he contracted, you know, the virus, and then he was taken into a facility, and at the end of the day, you know, he, you know, they actually billed him and required him to pay before he was released. I do not know whether, you know, somebody came and paid it for him. Imagine such a situation whereby you contract it, you know, in a way that is actually, you can say, was brought by, you know, action, even or circumstances that, one, beyond your control, and two, you know, a measure that was put in place by government. So just to roll back, I also agree with Advocate Kamau that it is not proper to actually to force people to pay for their own quarantine, especially those ones that are collected or you know, are collected by tracing and contact, you know, by contact tracing, because then you're actually telling people that, you know, we will come after you and force you to this form of treatment or quarantine, and you will pay for yourself. I mean, in as much as we cry government's idea, we idea government in a lot of ways. You know, we pay our taxes. You know, there is a lot of money that we pay to government. Belgium, citizens, you know, residents are paid about 800 USD to stay at home. Because at some point, in as much as yes, we need to actually show that kind of effort. You know, governments have also realized that sometimes you need to incentivize your people so that they also keep into, you know, some regulation or some measures. So yes, state should be paying for you know, the services, especially if they're receiving grants, whatever it is that they're receiving from outside to help manage COVID. Then they should really utilize that money very, very well, first to assist Kenyans and people that contract this virus in Kenya.
What I feel Kenyans have done well in this period is really around innovation and sharing of information. I've seen a lot of civic engagement around COVID-19. I'm sure this is not work that was planned for before, but people have organized and engaged and are really pushing to ensure that everybody has the right information at the right time. Utafiti Hub is one of the people that we can thank for sharing information around what's happening with the pandemic. The University of Nairobi School of Law have a COVID-19 management and response bill that they shared with the Senate and the National Assembly. The School of Engineering is developing ventilators. So there's been a lot of innovation and organization around the pandemic response from people outside of the government, and the citizens have really been trying to play their part and play their civic and have some level of civic duty towards this response. So I think that has gone really well from the country, and we've never seen such high levels of organization and galvanization around a specific issue. From the government, I would say there has been increased transparency in how they've been providing information. I think we can at least applaud the Ministry of Health for, one, providing daily updates, but also for shifting how they provide these updates. So not just telling us numbers. This has improved in terms of talking about resources, talking about plans, talking about what we plan to do after. And this has been especially important because Senate has called upon them to talk more around the resources, what's happening with personal protective equipment, what's happening with hiring of what's happening with hiring increased healthcare workers. So I've seen an improvement in transparency for the Ministry of Health, which is something that I think they should carry through post the pandemic in how they engage the citizens. What we haven't done well, and I would say this is a dual problem from both us as citizens and from the government, is as citizens we've not been following the directives as well as we should have. We have issues of parties still ongoing, people breaking curfew orders, sausages and beers. These are issues that we really shouldn't have. And I think this is problematic only because, and we have to accept this, we don't trust our government, we don't listen to our government. And we don't trust our government because they have been poor at governing us. So they haven't built a relationship of trust with us for the last decade. And it's very difficult for them to try and build it now in a 2-month pandemic span. The countries where they've been able to manage the epidemic quite haste quite quickly and speedily. Germany, South Korea, it's because when they do give directives, the citizens listen. And this only happens because the citizens trust that the government have their best interests at heart. We don't have that in Kenya. It's a deep problem that we have to understand is dually an issue, because if you're voting people that you don't trust, that's on you. Stop doing that. And if you can't build trust with your citizens, that's on you as an official. You have to do better. And I think those are the things that we've done poorly, and we need to really consider what public trust looks like for us post-COVID-19 pandemic.
Thank you so much, Nerima. Bwana Kamau?
The fact that as Kenyans, we're beginning to applaud leaders who are doing the right thing, rather than applauding leaders who, looking at leaders who, in terms of who wears the best bling, which is what we have been doing, or who can insult who better than the other. We are now looking at which leader is leading us to the best place that we can survive as a people. So Ngilu is the best example. She was able to transform and change the business of the Kitui textile industries from making uniforms for our police and for the army into one that was now producing masks that were needed for the crisis of the time. For that refocusing in terms of what is good for us as a people, I think that is one of the pluses we should take from this crisis and that we should carry forward post-COVID-19. I have also seen a few other examples of governors and other leaders, the Minister for Health and the Governor for Mombasa County, people looking at who is helping us as Kenyans. And the fact that the politics of narcissism and populism is seeming to die is a good thing. We do not want leaders who just come and dance, like it's a beauty pageant, and then we vote for them just because of how well they can dance, not how well they can take us to the next level. I pray that that sort of politics dies forever with COVID-19. And if it did, then I will say that this crisis was good and it was a godsend crisis. Other than that, I have looked at the innovations that are coming from every corner. I have seen companies in Kenya that are making ventilators. We have seen countries in the developed world that do not have enough ventilators. And if we escalated these innovations that are coming from Kenya and other countries in Africa, and we started becoming a medical equipment manufacturing country or continent, because I look at myself as African first, then we will be, taking very good positives out of this crisis. The fact that as a people we begin to think of what we can do ourselves, rather than all the time crying out Serikali's idea, is a good positive in my view. Because remember, part of the reason we do not trust our government is because we still see our government as representative of the colonial past. And it is because we have never reconstructed the Kenyan nation or the Kenyan state. It is still seen as worthy of being sabotaged by us. And for me, we need to start looking at how we can reconstruct that post-COVID-19, more or less the same way that the Russians and the Americans during the bipolar world, the Soviets versus the capitalist West, were fighting in the period after the Second World War. We need to start looking at our survival as a people. The Americans and the Russians discovered that each of them with an atomic bomb were capable of destroying the entire world. And when you start realizing that we all belong in the same boat, then we stop rocking that boat. We stop making sure that it is not leaking. We start working together. And for me, I don't know how this works well for Utafiti Hub. And thank you, Utafiti Hub, for making this possible for people to still interact at this level, even in these times of the crisis. I would want a situation where the Building Bridges initiative, you notice that I did not talk about the handshake, because the handshake is anathema to the ear in this period, is absolutely important. We need to bring hygiene to our politics.
For me, as I mentioned, I think what has happened is that this epidemic has really disclosed a lot in terms of, the structural failings and features that we have in Kenya in as far as health and social safety systems are concerned. And I think as Kenyans, we've really pushed in as far as asking government to have more investment to repair this. I've seen a lot of health workers and their union coming out and speaking about the challenges they've had, especially around this time. And it really creates a lot of need for government to act. So that's a positive move in as far as people really coming out and speaking about, the gaps that are there in the system. That is an as far as positive aspect of how Wananchi and organizations have acted. Government, of course, as alluded before, a lot of information has been coming to us, and as I said, it is not. We should not take it for granted, because there are countries whereby they don't really receive the updates that we're receiving. So it's really important that the government continues with this in every other aspect of their implementation of other things, and especially disasters. Every other disaster that is happening, or any other issues that we really need to be updated about or on, the government should really come out and speak in the same zeal that it has done on COVID-19. In as far as all the bad things that have gone on, of course, the issues around exposed issues around police brutality around this time, we really have realized what we really need in as far as further reforms in security forces. And they were given a mandate to try and implement some of the measures that have been put by the Ministry of Health, but we saw a lot of brutality. Of course, issues around quarantine as a punishment and issues around rule of law issues really are coming up and need to be further addressed. In as far as what Wananchi is doing wrong, in discipline, even at times when they should know that they really hold a lot of power in as far as controlling how this pandemic goes. All in all, learning curve, we can learn and change a lot and learn for future pandemics. Thank you.
Thank you so much, Roland. Wanaolekina?
I'm not going to repeat the good things that the government have said, because Bonakamau, Nerima, and Roland have said. So I want to go to the gaps that we have seen. And one of the biggest gaps that we have seen is how unequal we are as a society. When the Minister for Education says that we are ready to do an exam, and because our children have been learning online, that actually makes one wonder what country he lives in. Because what I know is that even in Nairobi itself, let alone counties like Narok, Kajiado, Kakuma, Turkana, Samburu, Wajir, all those other counties, where the infrastructure, the network is still an issue. There are places where you cannot access the phone yet, and that is not playing down the efforts that the government has put to open up those areas.
But maybe just to add, even in some parts of Moranga. So
yes, that's what I'm saying.
Parts of Nairobi. Yeah.
I said even in Nairobi, I said that we do not have that connectivity, and the gadgets. There are people who have to, even if they actually had the gadgets. Now the question would be, do I buy airtime or buy food? So there are these issues that we are taking for granted, but I know that this has also, this situation has exposed that unless we do something to close this gap of inequality in the country, we will not go anywhere. So yes, a lot has happened, and we are saying there are positive things. And even this learning that we are unequal is good. Companies have done very well, like Safaricom and others that have tried to, equalize the society by providing. If you have a network, okay, we are going to reduce the price of the internet, and so that people can access it. But even when it is reduced, there are those who cannot still afford or who do not have gadgets. So that's one. Secondly, we have realized that we are focused outward a lot, sometimes ignoring and improving our infrastructure because we know we can afford to go, let's say, to hospitals in India, in America, in South Africa. But We did not anticipate that one day our airports will stop, they will be closed, and even with the money, you cannot go out. And so this is now a very important point in life where we must start focusing inwards. And as I said earlier, some people, and I included, thought that Donald Trump was mad when he was saying America first. But now I'm also encouraging that Kenya first. When we have facilities, can we improve? Other than take your money abroad, can we try and encourage our people to invest locally? There are people who have money and they can build hospitals as good and as big as those ones that people go to in India and South Africa and America. Invest here, and government also. We've seen that a lot of our facilities, people are suffering, yet that's why we're saying our health infrastructure is actually wanting. So can we improve that? The other day, and not just COVID, these floods also, because we are talking about all disasters and not just COVID, a bridge connecting Narok, the main road, was washed away. And what happened? So we realized that actually a county can be cut off, locked down just because there's only one road leading into the county. So with all these lessons that we have learned, I hope that post-COVID and post these floods, we will now put up more resources towards improving this country so that it's a better place that we'll be proud of, and so that even when you are given a green card, you say, I'm not leaving my country, because you have realized that there's no safe place. That probably when we survive this, you are safer in Kenya than maybe in the US or those other places that have lost more people. So let's be proud to be Kenyans, and let's work hard to make our country better. And for those Kenyans who are so hard-headed, who are refusing to listen to the government's directive, who are refusing to keep social distance, who are, trying to, when counties are locked, they try to look for panya routes to go. We're telling them that your government does not hate you. Okay, we don't trust it a lot, and that's why, because of what has happened in the past. But this time, it is actually trying to safeguard you. It's your life it's trying to protect. And for government also, can we try and rebuild this trust? Because this trust deficit between the public and government is because of the way you have mistreated your citizens in the past. Can we trust you when we give you our resources as government? Can you utilize them in developing our country, and not some people, not all the, but this of course is not the entire government, it's individuals in government who sometimes misappropriate those resources, and leading to the problems we are seeing all over the country. So can we be a better people? Can we be a better country? I think we can. So let us not give up. You can see that when the world is locked, we are still surviving, and I'm sure we will survive even without flying out, and we shall evolve better as a people, and then we should build on that positive note and make this country greater than it is today.
Thank you so much, ladies and gentlemen. Thank you so much for your time. We as Utafiti Hub say asante sana to all our panelists, and for particularly taking this time to weigh in on these issues. We celebrate you as well. And I think we seem to be agreeing that we do not have any other Kenya. This is our country. We have nowhere else to go. Anywhere else we go, we always know that we have to come back. And as the CS Health indicated, these are unusual times. Hence the need for one and all to vacate their normal for the safety and security of themselves as well as that of others. This call, in our view, applies to government and citizens in equal measure. We appreciate that the COVID-19 scenario is unprecedented. And understandably, therefore, everyone is learning and everyone is trying. Sometimes we'll get it right, and sometimes not so right. But what we urge for is empathy in how we conduct our business, both on the side of government and on the side of citizens. Thank you so much for watching. Feel free to leave a comment below on what you would like for us to discuss in our next session. And please remember to subscribe to Utafiti Hub through our subscribe button below.